Chapter 4: Sudden Illnesses. How to help someone with asthma. Help the person use his or her physician-prescribed quick relief rescue inhaler. Shake the inhaler several times and apply a spacer if available. Next, hold the inhaler upright and have the person place his or her lips around the inhaler or spacer. While the person breathes in slowly and deeply, depress the inhaler. If using a spacer, press down on the inhaler and have the person wait 5 seconds before breathing in. Tell the person to hold his or her breath for 10 seconds and to breathe out slowly. A second dosage may be given in 30 to 60 seconds. After assisting with the inhaler, call 911 if the person does not improve, repeated attacks occur, or a severe or prolonged attack occurs. Severe allergic reactions. Here's what to do. First, most people who have a severe allergic reaction will own a epinephrine auto-injector, also known as an EpiPen. This EpiPen has life-saving medication in it to help slow down the progress of the infection so that the person may get proper medical assistance. If you suspect a person is showing signs of an allergic reaction, such as trouble breathing, swelling of the tongue, throat, or face, make it known to the person and ask them where their EpiPen is. If the person has his or her own prescribed EpiPen, you may need to help him or her self-administer it depending on how far the condition has gone, and once administered, immediately seek medical assistance. Also, if the person can swallow, give them an antihistamine. It is not life-saving because it takes too long to work, but it can help prevent further reactions to occur while they are getting to the proper medical assistance they need. Now we're going to watch a video on how to use an epinephrine auto-injector, aka an EpiPen.
Skill: using an epinephrine auto-injector. Help a responsive person use his or her physician-prescribed epinephrine auto-injector. If the person cannot use his or her auto-injector, and if allowed by your state law, you may give an injection. Find the injection site on the outer mid-thigh between the knee and the hip. Check for coins, keys, and pant seams, which could obstruct the needle. The needle can go through thin clothing. Remove the safety cap. Hold the epinephrine auto-injector without touching either end of it. Press the auto-injector firmly until you hear a click against the side of the person's thigh, halfway between the knee and the hip. Do not use a swinging motion because you may miss the injection site. Hold the auto-injector in place for about 10 seconds, and then pull it straight out from the leg. Rub the injection site for about 10 seconds. If the first dose does not help and the arrival of the emergency medical service will exceed 5 to 10 minutes, consider a second dose. Dispose of the auto-injector properly.
When you suspect someone is suffering from a heart attack, take the following steps. 1. Call 911 immediately. 2. Have the person sit with knees raised and lean against a stable support. 3. Loosen any tight clothing. Stay with the person and monitor them until EMS arrives. Ask if the person takes any chest pain medication, and if so, help him or her take it. If the person is alert and is able to swallow and is not allergic to aspirin and has no signs of a stroke, help the person take 1 adult aspirin or 2 to 4 low-dose baby aspirins. Make sure to monitor breathing. In case the person becomes unresponsive and stops breathing, you should then begin CPR. If you come on scene to someone you think is suffering from a stroke, take the following steps. 1. Call 911. If responsive, position the person on his or her back with head and shoulders slightly raised. If the person is unresponsive, place on his or her side. Also, some signs of a stroke are a drooping face and slurred speech. What to do when facing someone who has fainted? First, check for breathing. If breathing has stopped, call 911 and begin CPR procedures. If the person is breathing, keep the person flat on their back. Feet can be raised 6 to 12 inches or to a height that does not cause pain. Monitor breathing. Again, if breathing stops, perform CPR. Make sure to loosen tight clothing. If the person fell, check and treat any injuries found. Wipe the person's forehead with a cool, wet cloth and monitor until EMS arrives. With fainting, then seek medical care if there are repeated episodes, the person fainted for no apparent reason, the person does not regain responsiveness quickly, or the person has diabetes, seizures, is pregnant, or has a loss of bowel or bladder control, or is over the age of 50. Now let's talk about diabetic emergencies. Here's what to do if the person is responsive, alert, and can swallow. The person may be able to tell you what to do. If so, follow their instructions. If not, here's what to do. If the person has a blood glucose meter, allow him or her to check his or her blood glucose. Then, if necessary, use the rule of 15. Also, use the rule of 15 when testing is not possible, testing shows low blood glucose levels, or profuse sweating or shaking occurs. If the person is responsive, this is how the rule of 15 works. Have the person eat 15 grams of sugar. Wait 15 minutes for the sugar to get into the blood. Then recheck the blood glucose level. If it is still low or if no testing is available, give the person 15 more grams of sugar. If there is still no improvement, call 911 and continue to monitor the person until EMS arrives. How to care for someone who's experiencing a seizure. First, move nearby objects to avoid injury. Place something soft under the head, such as a rolled towel. Do not use a pillow. Also, when in a pinch, having the person's head laid in your lap is sufficient. Time the seizures from start to finish. Keep bystanders away. Make sure to also track how many seizures are happening as well as how long each one lasts. When someone is experiencing a seizure, call 911 if any of the following occur. The seizure lasts longer than 5 minutes. Series of seizures following one another. The person has breathing difficulties after the seizure. The person has diabetes or is pregnant. The seizure happened in water. This is the person's first known seizure. The seizure is injured related, or there is a slow recovery after the seizure. Once the seizure is completed, keep the airway open by placing the person on his or her side and head on a rolled towel. Monitor breathing, and if it stops, perform CPR. Allow the person to sleep if they're tired. Stay with the person until he or she is alert, or in such cases where you have to call EMS. What to do with someone who's experiencing shock. 1. Treat injuries first. 2. If responsive and breathing normally, keep the person flat on their back. If there is no sign of injury, consider raising the feet 6 to 12 inches or whatever height is comfortable for the person. If unresponsive, roll the person onto their side. Prevent the loss of body heat. If the person does not improve in a timely manner, call 911 and continue to monitor the person until EMS arrives.